reform government, many aspects of our health system were at their breaking point. Thanks to increased investments and the excellent leadership of Adrian Dix, our health minister, and my dear friend, Adrian is such an extraordinary person. We have made progress on some important aspects of healthcare, including repealing Bills 19 and 29 to prevent further privatization of healthcare services. I have to stop now and read that again for myself. We repealed Bills 19 and 29. Bills 19 and 29, as I said, led to the firing of 10,000 workers, mostly women. That was the largest mass firing of women in Canadian history. They were fired from long-term care service. Contract flipping ensued, pushed their wages further down and standards down. They had to work in multi-facilities to make a living. When we came into government, 90% of senior care homes were not meeting the bare minimum care hour requirements. We have invested $548 million already to increase senior care home hours. So, pardon me, pardon me. We also implemented the change to a team-based primary healthcare model, including the creation of the primary and urgent care clinics and primary care networks. Nanaimo has received a new urgent care clinic and the island's first nurse practitioner-led clinic. And we recently announced a new primary care network that will be coming for Cowichan. We have increased investments in healthcare infrastructure, which has resulted in a new hospital being approved for Cowichan and a new ICU for Nanaimo Hospital. We increased surgeries and decreased wait times in the order of 40%. We also increased surgeries now to the point where we will be caught up and up to date on all surgeries, including those canceled during COVID, by February in the Island Health region. We increased diagnostics such as MRIs with a strategy that involves running the machines 24 hours a day and investing in additional machines, such as the one received by Nanaimo Hospital. It is so important. This is a bottleneck in our healthcare system, where government in the past, the BC Liberals, could make immediate savings by not operating those services, by saving money from diagnostics and privatizing some of those services. And that led to huge backlogs in our system. So we have taken a different approach, and we are investing in those machines, that technology, and the people to operate it in the public realm so that we can move this system effectively and efficiently forward. We've invested in more training seats for a variety of medical professions, and we've implemented a doctor and nurse recruitment strategy. As mentioned earlier, we also removed MSP premiums, and we decreased pharmacare deductibles. Moving forward in strengthening our healthcare system, we are committed to first addressing the ongoing pandemic by continuing to follow the experts and the science. We'll do that by hiring 7,000 new healthcare workers in long-term care and assisted living as part of our recovery plan. This will include priority training for those who have lost their jobs due to COVID, and includes paid training to make it more accessible as we use the role of government and public services to help create employment for those who have lost their jobs in other sectors, and thereby achieving the goals we have for our health system and having a thriving, healthy community. Seems to be everybody's goal, and we are determined. We launched the Hospital at Home program, which has been successful in other jurisdictions. It relieves pressure on our hospitals, allows for improved care in a home environment. While we still work on recruiting more doctors, we'll also launch BC's second medical school to further expand our healthcare workforce. This is a foundational step, and I'm very proud to be a part of announcing that. We will introduce a 10-year cancer plan, which includes a new cancer treatment center in Nanaimo that will provide more accessible treatment options closer to all of our homes. Keeping trained, qualified staff is critical for providing better care. We will develop a staffing retention strategy that provides workers in long-term care and assisted living with leveled up wages, similar to those for early childhood educators. And this will continue even after the pandemic ends. And it will restore provincial standards for wages, benefits, and working conditions that were cut by the BC Liberals. We'll expand publicly funded home care to provide better care and help with daily living, such as bathing, dressing, meal preparation, and more, expanding the scope and service so that people can stay in their homes for as long as safely possible. It will also improve continuity of care with seniors receiving visits from a more consistent group of care aides. Now, we are investing $1.6 billion, a COVID health investment, in order to achieve this. And as you can see on your screen, that's $374 million for public health measures. That is contact tracing, lab capacity, services to rural communities, and more, as you can see. $416 million for community and long-term care, which of course will cover the staffing increases that I spoke about, and the wage increase for the single site initiative, correcting what was done with Bill 19 and 29. And then $784 million for recovery and increased capacity, which will institute the programs that I spoke about, buy supplies, and hire those 7,000 extra healthcare workers.